Welcome back. El Rushmore serving humanity simply by showing up. John Fund today on the trail, the Wall Street Journal. Beware Obamacare's fine print. I referenced this earlier. There's a reason the Obama healthcare plan is being rushed through Congress this summer, because the American people would likely never support it if given the time to absorb and understand such fine print as the unions being exempt from any tax increase on health care benefits provided by the boss. If the union carve-out isn't sufficient to excite public anger, wait till you hear about the version of the Obama plan prepared by Senator Kennedy. That plan would specifically exempt members of Congress from many of the Obama health care plan provisions. As the U.S. Office of Personnel Management notes, members of Congress enjoy the widest selection of health plans in the country. On page 114 of the Kennedy bill, a similar array of choices would not be available to other Americans in the future. Instead, they would be shunted into health insurance plans under the straitjacket of whatever the government decides is a basic plan. So the question that needs to be asked, the one question, only question really, you need to call your senator and your member of Congress, and you need to ask them very simply, are you going to opt out and forego your current health care plan in order to join the health care plan provided for most Americans by the Obama government? And what do you think the answer you're going to get is? The answer is, hell no, I'm not giving up my health care plan, but we can't provide this kind of health coverage for every American. So members of Congress and the Obama administration will not be subjected to the health care plan they are going to come up with. They need to be, this is what the doctor was trying to get at in his question to Obama. Hey, you're going to come up with a public plan. Your wife or your daughter comes down with an illness that your current plan, the public plan, doesn't cover. Are you going to opt out of it because you can? And you're going to go get better coverage? He wouldn't answer the question. The answer to the question, he's never going to be subjected to the plan they come up with for all of everybody else. So you need to, just today, send him an email, call him up, and ask him, are you going to give up your current health care plan and enroll in the new public plan the Obama administration comes up with? And you know damn well they won't. And if they say that's over. It's over. If members of Congress are not going to join the plan they're devising for you, you don't want the plan. You don't want the plan. And I can tell you right now, they're not going to give up the health care plan they got. And they're not going to join any piece of garbage plan they come up with for all the rest of us. And if they tell you they think about it, they're not telling you the truth. Obama wouldn't even answer that question last night. He had to start talking about, oh, we're treating too many people for too many things they shouldn't be treated for. We're not focusing on quality of coverage. We're focusing on quantity. That's obfuscation. Just ask him. You going to give up your health care plan, Senator so-and-so, and join the public plan with all the rest of us? The plan that you write for us, the plan that you vote on, the plan you might not even read before you vote on it. Just like you didn't read the stimulus bill. And just like, what's his name, Waxman doesn't even know what's in his own cap and trade bill. Because he hasn't read it. Are you going to opt out of your health care plan that you have now that everybody knows is so great and join us in the public plan you create for everybody else? If they say no, then the whole thing is off the table. If it's not good enough for them, it's not good enough for you. They don't have and should not have the power to determine what you can do taking care of yourself. You should not give up the power that allows them to say they will permit you to do that and to do that, but they won't permit you to do this as you seek your own health care. You turn your health care over to the state, and you're giving up all control over your health care. You are in a crapshoot. You may as well have walked into a casino. If you think your life is going to improve by giving up control of your own health care and your families, in exchange for some wizards who cannot manage Medicare, cannot manage Medicaid, cannot manage Social Security, cannot manage a DMV, cannot manage the Great Society, the war on poverty, cannot manage the porculus bill, cannot manage a damn thing they do. You're going to turn over something as important to you as healthcare decisions to a bunch of people who will not even enroll in the same plan they're going to make you enroll in. The answer is no.
Learn, then spread the word. Rush on the EIB network. And now, America's newest all-night sensation.